And I think that contrast between maker and victim, you know, the passivity, the feeling you're not in control, particularly of your own body. And those of you who know about ovarian cancer, and I know some of you do from having spoken to you just recently, yes, there are some early symptoms, but for a long time it was called the silent killer, the whisperer. The assumption was that the symptoms didn't appear until it was too late to really do much about it. It was only in 2007 that a huge nurses' survey of ovarian cancer people, survivors, if you will, determined that yes, most of these women, I forget the percentage, had experienced at least one of four symptoms. The problem being that using these symptoms in diagnosis is very difficult because they could be caused by so many different things. You know, urinary frequency, difficulty digesting the normal sized meals that you would eat, abdominal pain, and then this strange bloating that many of us discovered but didn't know that it could be a symptom of ovarian cancer. So the secretiveness of the disease, I think, makes one feel even more that one is a victim, that one has no control, that these things are happening very quietly inside, and you can't do anything about it because you don't know it's happening. So creating art is a wonderful counteraction to that cluster of negative feelings, I think.
Aren't you interested in knowing what these poems are actually like? I'm going to ask Judy maybe for the first poem that she reads, to read a poem called Bear Game, which I love. I'm a cat person. If any of you are dog people, you're just going to have to bear with us. You've got two cat ladies at the front of the room.
Well, we have a wonderful dog poet sitting over there, so all is not lost. Okay. Bear Game. Nearly bald, this stuffed bear was meant for my small niece to cuddle against cancer. But now she's well, my fierce coon cat inherits. Bear becomes prey and kitten, licked, stroked, chewed, kicked, torn. From the next room I hear the hunters growl. Bear's sparse fur is soaked in saliva, stinks of cat's breath. His snout's a perfect fit for a cat's mouth. And what a lively arc when Galway lofts him into glittering air to catch him in his teeth. Cancer loved Heather and me like this, seized us by the scruff of the neck, to give long, hot licks till we were bald and limp as newborns, dragged us from room to room till finally some new toy offered it a better game.
Yeah. There's so much I want to get you to tell us about that poem, but maybe did you know you were sitting down to write a poem about cancer? What were you doing?
The faintest clue, and I will tell you now, I keep a notebook as many poets do, and I had it out. It was early in the morning before school, and I had a little time to just play with my notebook. And I heard Galway the cat from a farther room, and I simply jotted this down in the notebook. November 30th. Watching Galway drag his wet, smelly, stuffed bear around the room. Heard his fierce hunting growl all the way from the other end of the house. He licks it, loves it, then bites it, kicks it. So there it was, and a couple days later I went back to my notebook, sort of thumbing through, and I saw this, and I just kind of free wrote, and I got this far. Newly bald, the stuffed bear was meant for my small niece to cuddle against cancer. But now she's well, my fierce coon cat inherits. Bear becomes prey and infant, licked, stroked, chewed, kicked, torn. From the next room I hear the hunters growl. Bear's sparse fur is wet or soaked with saliva, stinks of cat breath. His snout's a perfect fit for a cat's jaws. And what a lively, lovely arc he makes when Galway lofts him into unresisting air to catch him in his teeth. So it's part of a poem, maybe. It's very rough draft. There's still some uncertain word choices where I write in 2 words with a slash in between them. But it's certainly not, as far as I could tell at the time, a cancer poem. I mean, there's that one reference to my little niece having cancer, but it's practically in parentheses almost. It seems to be a cat poem, as far as I could tell. So then, about a week later maybe, I was working with my poetry class of juniors and seniors actually on using a notebook and on revisiting it, and not giving up hope if a poem seemed to be going nowhere. So I wanted to model, and I went back. And from the line I stopped, what a lively arc when Galway lofts him into glittering air to catch him in his teeth. Suddenly the word cancer came down on the page. Cancer loved Heather and me like this. And from then on, you know, the poem just went and ended till some new toy offered it a better game. And I was kind of appalled at first that this is where the poem went. And I was partly appalled, I think, because I sounded so angry and bitter in the second half of the poem. And I also sounded to myself like an object being dragged around, and I didn't much like that image of myself. But it certainly was part of the cancer experience for me, one emotional piece of it. And that's one of the things I love about writing poetry and about reading poetry. You know, Robert Frost, I'm a New Englander, so I quote Frost and Dickinson quite a lot. But one of Frost's famous lines was, no surprise for the writer, no surprise for the reader. Well, I love reading poems and coming to a sudden twist, a turn, where I think, I'll bet the poet didn't think it was going there. Wow! You know, another of my favorite poets, Mark Doty, often says in his workshops that the most important thing in early drafts especially is locating the tension in the poem. Where is there going to be this dynamic thrust of something against something else? And clearly here it was, playful cat against aggressive, frightening cancer. So I think that's part of why the poem works, to whatever degree it works.
I'm going to change around a little bit the order that I thought we might go in, because I think one of the things that's very striking about that poem is first the line of likening both yourself and your niece to this toy, which you describe as prey and kitten, right? And cancer sort of analogized to your cat. So this idea of being prey and kitten licked bald by cancer, and then later in the poem the line, cancer loved Heather and me like this. And if you will indulge me, I'd like to read another one of your poems. This is from a different volume. So that poem is from, so yeah, my poems have cats in them. This is from an earlier book called Reviewing the Skull, which I've had the pleasure of teaching twice now. And I'm going to read the first poem from a series called Recurrence Suite. And it's entitled After X-Rays. I am in love with the lesion on my liver, how its quick thickening defines the dark. Such lèse-majesté, I love how it flies a skull and crossbones from the heart of the mothership. I'm in awe of its discontent. How did it know me across a crowded room? I love it with sleepless nights. I love it on alternate days. I love it incestuously. My secret that defies the hot, bright shower of particles, that eludes the fumbling knives, how it clings to its glandular host, how it finds its way around my slippery defenses. I'm in love with its little suction cup feet, with its mysterious past, its hunger. I could die for its grim dividings, for its knowledge of hidden names. So this is a striking poem for many reasons. The first line, for those of you who are poets, I am in love with the lesion on my liver. The rhythm and the sound in that line is amazing. And of course, even more amazing is the sentiment of this line, the notion of being in love with the lesion. Tell us a little bit about that unusual and complicated way of speaking.
It is. Well, I grew up in a family of musicians. My parents both went to Juilliard, my dad a pianist, my mama a flute player. They both became music teachers and composers and for time in their lives. And I grew up with lots of musical instruments left around the house. An auto harp lying under the piano, for example. 2 pianos, a grand and my mother's upright. I heard music lessons going on in 2 different rooms when I came home from school. And I grew up playing cello and singing in my dad's church choir. And then in college, I played in the Vermont Symphony and I took organ lessons and I sang in madrigal group. So music and listening for the music of language, I think, came early in my life. My mother later became a children's librarian. My grandmother was a librarian. I had books read aloud to me, including poetry, a lot. So I can fairly easily turn myself over to the music of words and not know where they're going and feel okay with that. So when I heard the line in my head, I am in love with a lesion on my liver, I trustfully wrote it down. Kind of baffled by where this came from. But I think part of being an artist of any kind, you know, and I have siblings who are visual artists and a composer in the family, is trusting your unconscious or your imagination or whatever you want to call it and going with it, knowing you can always change it later. You can always take the thing out, and especially with a computer, it's dreadfully easy to do that. So I think I kind of enjoyed the braggadocio, the sort of swagger in that line. It felt like a way of getting back at. I think this was my 3rd recurrence. No, it was my 2nd recurrence. And I was pretty terrified by the thing on the liver. I thought maybe it's liver cancer, who knows, you know, and my previous surgeon had moved, and I think he felt when I presented myself again, oh God, you know. And I'm sure he was very uncomfortable with the situation, and he wouldn't cross the room and take my hand. He just said, I can't do surgery on this. The liver lesion is in too difficult a place. I said, well, I've heard we could use tamoxifen and shrink the tumor, and then maybe you could do it. You know, the eternal optimist. He said only worked 20% of the time. There was just no affect in his voice, and I think he really needed to distance himself at this point. And I said, well, I'm feeling great. Could the scan be wrong? And he said, hell no, it lit up like the 4th of July. And at this point, I brought a woman friend with me, and she was rolling her eyes, and I think at that point we both decided to try to get a second opinion, which I did. And I got a surgeon at Johns Hopkins who was the head of the cancer program there, who did the surgery successfully. But I think this was a period where I was more scared about this recurrence, maybe, because it seemed as though it could be so many different things and was so problematic. So that playing around with this attitude, this defiant swagger, dark humor, maybe, felt good, you know? It's not a poem I read very often at readings because I think it can be so confusing and maybe disturbing to people. But I'm so glad you like it.
Well, one of the things that has always fascinated me about your work is that the metaphors around cancer and the relationship to cancer really change. And cancer is a disease of the self. It's not the same as going off someplace and being infected by something that is so clearly external. And I think that there's a way in which trying to figure out how to relate to the self as producing the cancer, as producing the cells, as producing the tumors, that also becomes a real challenge for people to figure out who they are around this disease.
Yes, and I've been looking back at Susan Sontag's first book about illness and metaphor, which came out in the 70s, when less was known about cancer than is known now, certainly, and there was a tendency to blame the patient. And especially with ovarian cancer, there's a long history of its association. One of the risk factors, of course, is not having had children, not having been pregnant, and that's true of me. And W.H. Auden wrote a terrifying poem called The Ballad of Miss McGee, who's pictured as a very repressed, desiccated, kind of life-hating spinster. and she's cut open, and lo and behold, she has cancer. And it's just very disturbing to have the blame being attached to the patient that way. And I don't particularly like the military metaphors either. I mean, the idea that this disease is an invading enemy and that it needs to be cut, poisoned, and burned, and that you have to fight the battle, you know. And I know that the imagery is helpful for some patients, so I don't want to knock the fighting the battle. It's not an image I'm comfortable with, and I think one reason I'm enjoying writing poetry out of these experiences is that other images come to the surface for me. I have a late